హాయ్ అందరికీ నమస్కారం. నా పేరు డాక్టర్ శశికాంత్. నేను ఒక సీనియర్ కన్సల్టెంట్ ప్లాస్టిక్ సర్జన్, కాస్మెటిక్, క్రేనియోఫేషియల్ సర్జన్. How do you take care of your nose after surgery, after rhinoplasty? So what are the post-operative care that we should take during after the rhinoplasty? So generally what happens after the rhinoplasty surgery? Generally we close both the nostrils for 2 days, 1 to 2 days, depending on what type of correction that we do. So generally, if we do osteotomies, then we generally close the nose for complete 2 days. So we pack the nose for 2 days so that there will not be any active bleeding or anything. So after 48 hours, we take out the nose block, and we make it free. And similarly, for any rhinoplasty, you have to, we apply a splint, nasal splint, which is made up of either plaster of Paris. So plaster of Paris, we shape the splint accordingly to maintain the shape that we give after the rhinoplasty. So what happens, rhinoplasty nose is a place where we cannot give a proper fixation or reduction as we do in long bone surgeries or bone surgeries or anything. So the only way we have is apply a splint from outside to maintain the position of the nose and maintain the shape of the nose that we give during the surgery. So that splint should be maintained for at least 2 to 3 weeks, depending on how much changes that we do on the rhinoplasty. For example, if we do osteotomies, then we have to keep the splint for 3 weeks. So in that way, we have to, this splint will be secured onto the face with multiple plasters. It will be appearing a little bit bulky and messy, but it has to be done. So, and similarly, there will be some amount of facial swelling, especially when we do osteotomies. Because when we do osteotomies, what we do, we break the bone around the nose, so that any surgeries which we perform on the face leads to swelling of the complete face. So sometimes what happens, the whole face will become swollen. Nothing to panic, because that is the body's reaction to the surgery. So we generally deal with by regular application of hot or ice packs application, and as well as some tablets which reduce the swelling of the face or any part of the body. So in that way we deal with this one. And also, after we remove the packs, we should make sure that your nose, the inside of the nose, becomes free of scabs or the clots that we do. How do we do that? What we do, we advise regularly a steam inhalation at least 3 to 4 times a day, which will moisten the inside of the nose. And after you moisten the nose with earbuds, apply an ointment onto the earbuds and gently remove the scabs and everything whichever are there in the nostrils. So in that way, you keep your nostrils clean and clot free, and your breathing will be normal. Otherwise, what happens if you don't do this, there will be clots all over and they will block the nose, and it becomes painful to remove when you come for the follow-up with us. So in that way, you have to take care of your nose after the surgery. And once generally what we do is, even after 3 weeks, when we remove the plaster and remove the splint, we advise some soft massage over on either side of the nose to shape the nose accordingly. So because generally what happens after the 3 weeks, there will be soft union of the bones. So but still the bones can, by applying a selective pressure on areas where we want to modify, we can shape or model the shape of the nose to a certain extent. So in that way, we advise some massage after that, and continue your ice pack application or hot pack application till swelling is completely subsided. And sometimes one must also have to keep in their minds that the swelling in any of the rhinoplasty remains, subtle swelling or mild swelling remain for at least 1 to 2 months. So your result assessment, or when you see in a mirror, should not come to a conclusion at least for 1 to 2 months after the surgery, and you should wait for at least 2 months to see the proper shape of the nose, how it is, because tissue remodeling occurs for a long time after the surgery.